some daily Pso-Rite work. We're going to do the seated feet wide for our test, and then we'll Pso-Rite and then do a retest. What you're going to need is two yoga blocks, one for your head, one for your to be able to put the Pso-Rite on top of, and I'll show you what we're going to do with that. And so what we're going to do first is you just get into a seated position, widen your feet out as wide as you can. See how wide you can get it. So right here is about as far as I can go right now until I feel any type of tightness, whether it might be in my inner part of my thigh or my lower back or even up in the hip area. Wherever it is, we're going to use the Pso-Rite to be able to get into that area and help release it just a little bit, so then we can get a little bit more range of motion, and then I'll expose another area, and then we'll just kind of keep repeating that process until we maybe feel like we hit a wall, and then we'll give ourselves a break and do that again another day. So what I'm going to do here, sitting here, I'm going to use this as my test. I'm going to try to remember where my feet are at so I can have a good point of reference. And then I'm just going to hinge forward and I'm just trying to find those tender areas. So if I go here and I go left and right, where I'm feeling it mostly is in my lower back and a little bit here on my inner thighs. So I'm first going to test my lower back. And that's easy to do. I just slide it right behind me, grab onto both sides of it, and then I just lean back. Now when I'm leaning back, I'm going left and right. I'm trying to dig into that area and really kind of try to pinpoint a spot that's pretty tender. And if you can't find it here because of the leverage that you have, the positioning of the Pso-Rite, then the other position that we want to test out is we'll have our butt up in the air. But always, always, always do one position, test out, go left and right, and then retest the position and see if maybe that just helped it. So I go wide here. I got a little bit wider, not too much, but now when I come down, I actually can go a little bit further forward, a couple inches, not much, but now it's creeped actually down further into my lower spine where I feel that tightness, and it's more on the right than it is on the left, and it makes sense because I've had some back problems. Doing some deadlifts, I tweaked my lower L5, S1, and this has been a lifesaver to really help get that range of motion back, be able to lift again really effectively right away, because I got on it right away, and I didn't wait to go to a chiropractor or an acupuncturist because actually they couldn't get me in. They didn't have enough time in their schedule. So it was nice that I had this. I was able to get into it right away, got in the acupuncturist within a couple days, and chiropractor, and then I got on top of it and healed up my back pretty quick. So there's a little bit of an aftermath from that, so I feel that just a little bit. So I'm going to go in the lower position, and this is right down, like right at the base of the spine, just right to the right of it. And I'm just going to find that little chunk of muscle. And you can find, like you'll find, when you find bone, you'll know you're on bone, so you just kind of just slowly start to move in, and then once you find that little bit of muscle, then you can start to kind of move around and do some circles and do some of the acupressure points right into it. So that acupressure is what we're using with the Pso-Rite. This is the extension of my hand, and I'm just going to really try to pinpoint in that area. It's kind of hard because it's a really, really tiny area. And now what I can do too is that I pinpoint that area, and when I go to my acupuncturist, I can say, hey, way down in the bottom part of my spine, I feel this really tight area. I can't quite get it, or it's just not letting go for whatever reason. Do some precision needling on that area. Boom, might help it release. Or you just keep practicing, stretching, doing this test, retest, and it might release itself. So, let's retest. So I feel like I got a little bit wider. Now I'm going to hinge forward. So just a little bit, nothing crazy, just a little bit further. Still kind of feeling that general area. Like I said, that's a tough area way down in there. But I'm gonna still try to fight for it because I'm gonna do other positions that might actually help release it. So now where I'm starting to kind of feel it, besides in that lower back area here, is that inner groin part right in here, that inner thigh. So the way to get into that, because I want to have that inner thigh be relaxed while I'm massaging it. So what we're going to do is we're going to use 2 yoga blocks. Is we're going to use one for like a pillow. So if you have a bolster, or if you have a pillow, you can actually use that too. But put my head down right here. And then now I'm going to just open up this top leg. This is my left leg. I'm going to open it up. I'm just going to slide that yoga block right in there. And then I'm just going to lie that thigh right on top of it. And this is a very tight area. Plus, it's also really hard to get to. It's hard, it's awkward, or whatever. You have your massage therapist get in that area. It's tight. It gets tight really easy from sitting too much. So we're going to use both peaks, and we're just going to go right inside there, and I'm just going to search around and just find anything that feels tender. And once I find a tender spot, I'm just going to stay on it for just a little bit, and then I'm going to move to another spot. So what I'm right now is I'm stacked. My hips are stacked on top of each other. I'm going to actually move my right hip away from the yoga block to kind of help open up that hip. And that actually helps me get into that inner thigh a little bit better. Now remember also in the inner thigh part here is that there are some arteries that come down through here, so we want to make sure that if we feel any type of heartbeat at all, then we just want to back off. We don't want to be pressing into that artery. So, and just kind of just search around, and you'll notice it. You'll feel a heartbeat, and also if there's a lot of tender muscles in there, a lot of adductors in that area. So if something feels really tender, just back off and come back into it, back off and just come into it. So that's what I'm doing right now, is I'm just pressing into it, coming out of it, press into it, come out of it, and I'm just moving that Pso-Rite just kind of down through my leg, press out of it, come into it, and just start to shift my way down. So I'm just using one peak now. So it'll just be like one hand pressing into that area from different angles. I'm moving around up and down, doing some circles, really trying to get into that muscle. Now I just found another tender spot, and I can also extend my leg out, pull it in, extend it out. Now remember, if I extend it out, it's straightening the muscle, so the muscle's not, excuse me, relaxed. So I want to bend that knee and it keeps that muscle relaxed, and I can get into that muscle a little bit better. And then just watch out, the yoga block, the Pso-Rite doesn't fit completely right on the yoga block, so it might tip over. So I'm just hanging on to one peak, and I'm just pressing into it and just kind of using that peak also as some leverage to kind of hang on to it and to shift it really easy. So I can really kind of pretend like it is that hand that's massaging that area. So I'm working all the way down my leg, just going right down to my kneecap. Right in here, like right inside the leg here. So I'm just going to do one side. I'm going to do one side, test, retest, and see how everything feels. A little shakeout, open up everything. Feel like I improved a little bit on my width here. And then when you come down, I'm just going to take in a big deep breath and then just exhale. This is another form of like PNF stretching, where you take in a big deep breath, and then that exhale is going to be twice as long as your inhale, and then just exhale it out, and you can be able to get into that area a little bit more. So it just feels like a little bit more improvement, especially a little bit this way. Keep in mind, when you start to widen out this way and I hinge over, it's going to limit your distance. If I kept it here, I could probably go down a little bit further and I don't feel this area. I go back to a wider position, which doing this helped me get into. Now when I come down, I'm going to probably feel that area again, because now I'm in a wider position. It's a new threshold. And then now I can do this again, get in here, or I can go to the other side. So, excuse me, you just keep repeating that, and I can get into my upper glutes, I can get into that inner thigh on the other side, I can get into the back a little bit more, you know, test out going from your back here, this position here, to this position here, going left and right, even going down a little bit further and getting further up that spine and getting up there, because if those are really tight too, that's going to stop you from really bending over, because if that muscle is hanging on really tight, we want to use the Pso-Rite to help relax it until it is in a calm place, so that we can be able to hinge over a little bit further. So going up the spine here, I can find another tender spot which can play a factor in that. Just going left and right, just searching around. I'm really getting that mind and muscle connection. Open up the feet. Feel like I've increased just a little bit just on this video series here. You know, it feels a lot better. Now it's starting to kind of show itself way down here, kind of like right on the inside part of my leg. And sometimes I don't even need to necessarily use this right away. I can just use my own thumb and my own finger and just kind of just push into that a little bit and just try to help release it. Just push in a little bit, kind of move down that muscle, push in, drive those thumbs into it. Open those legs up again. So it just starts to kind of shift around when you start to really get into those muscles. Now it just shifted a little bit more into my lower back, in that left leg. So you can kind of see the pattern.